Mobile App Innovation Proposal, Diabetic Glucose Self-Management Proposal, DNP 702. My name is Rosette Adegbe, Bradman University, and I will be proposing on this topic. What is known about this problem? Diabetes mellitus is a metabolic disease characterized by the impaired insulin secretion and insulin resistance resulting in hyperglycemia. There are two types of diabetes. Type 1 diabetes, also known as juvenile diabetes, is an autoimmune disease mediated by a combination of genetic and environmental triggers, resulting in lymphocytic infiltration of the pancreas, islet destruction of beta cells, and lifelong dependency on exogenous insulin. The incidence is steadily increasing worldwide. The exact gene and environmental interaction precipitating this disease remain unknown. Living with type 1 diabetes is challenging for patient, family, and caregivers. Unlike type 1 diabetes, type 2 diabetes, also known as non-insulin dependent diabetes, is a complex metabolic disorder that is characterized by the inability of the pancreas to produce or utilize insulin, and as a result, individual blood glucose level became abnormally high. The focus of this topic is to highlight how patients with diabetes can practice the best self-care management routines in their homes. Type 2 diabetes continues to be a heavy burden on health and resources throughout the world. Several factors are known to predispose people to type 2 diabetes. According to the National Diabetic Education Program, obesity, physical inactivity, race, ethnicity, family history are also some of the main factors that contribute to people developing type 2 diabetes. Statistics shows that more than 29 million of Americans are living with diabetes and 86 million are living with prediabetes, a serious health condition that increases a person's risk of developing type 2 diabetes and other chronic conditions. If this current trend continues, it is predicted that 1 in 3 American adults is expected to have diabetes by the year 2050. Approximately 1 in 10 US dollar healthcare dollar is spent treating diabetes, and with the prevalence of diabetes rising, costs will likely increase. This disease creating an increase in price of their healthcare and overall life expenses. In 2002, the cost of diabetes care in the United States was estimated to be $132 billion of healthcare expenditure. However, improving in glycemic control have a positive economic impact. I would like to present a short video.
It is alarming. Dr. Dorothy Fink, an endocrinologist at NYU's Langone Medical Center, joins us now. Are these numbers surprising to you?
Honestly, no. Every day in my practice, I see patients with all sorts of endocrine problems, and all the time I say, oh my goodness, your hemoglobin A1C is elevated too. You have diabetes or prediabetes.
But from 100 million to almost, what, 500 million?
Right.
What's behind the surge?
You know, I really would say that many things cause it, but the truth is our world in the past couple of decades has become really more sedentary, and we eat processed food all the time. And it has led to our pancreases just working harder and harder and harder, and they're running out of steam.
Wow, and not only is this a potentially deadly disease, it also increases your chances at having other health risks as well. Can you explain?
It does, definitely. Well, just as the gentleman said in the segment, diabetes is silent. So for many years, people don't even know their blood sugars are elevated. And then it can affect your eyes, your heart, your feet, just about every organ in your body. So the point we want to focus on is prevention, and really focus to taking the time to exercise and think of food and exercise as medicine.
But is it as simple as going to the doctor and getting checked out? I get an annual physical every year,
Right.
But how can I tell if I have diabetes if the doctor doesn't know to look at it, or does he check everything with the blood?
That's a great question. Usually we have to think about your family history and other risk factors, especially for young people. But now even children are getting diagnosed with diabetes, so we really need to make sure that we think about that when you're going to see your doctor, and also making sure that you think about your family history, whether it's your parents have diabetes or you have a family member or yourself has gestational diabetes, which is diabetes in pregnancy. Those are all factors that can factor into knowing your risk.
And I was just about to talk about that. I love sugar. I think all Americans love sugar or whatever,
It's
but
true.
a lot of times we make comments with our friends, oh man, if you keep eating those cupcakes, you're going to end up with diabetes. How much of your diet really does play a role, or is it genetic?
It's a good question, and the genetics does play a role, but the truth is you can make a huge difference with the food that you take in on a daily basis and the amount of activity you do. So I have patients all the time where I had a gentleman last year, his A1C was 8.8, and he had Dave bagels every day on his way to work, which is like a New York staple, and he had sugary drinks all day with coffee, and he cut those out, and his A1C is now in the pre-diabetes range, and he went from obesity to a normal BMI. So it's possible to reverse it. We just need to motivate people and know that it is possible to do it naturally.
The purpose of this video is to bring the statistical awareness of this disease, risk factors, and the preventable complication. If diabetes remains uncontrolled, it can lead to a number of long-term complications, including kidney failure, blindness, stroke, heart disease, peripheral vascular disease, coronary artery disease. Glycemic control is crucial. Early intensive glycemic control to achieve A1C less than 7 has been shown to significantly reduce macrovascular and microvascular complications. In the past years, multiple products have been used to monitor and control glucose level, including finger stick 2 to 3 times daily, which most of the patients are not willing to do or afraid to do. And it does not give a clear trend on where the glucose direction is going. In this project, I collaborated with primary care providers, IT, and case managers. I explained to the primary care provider about the apps and how it will likely improve patient compliance, reduce urgent care, ED visit, and hospitalization for diabetes management. He pointed out to me the possible high costs that may be associated in implementing this project. However, he totally agreed. I also collaborated with case managers who are involved in managing and coordinating patient care needs to ensure proper utilization of services as well as resources. IT was one of the main persons I collaborated with because of their role is to assist in improving and monitoring network connection. In order to implement such app, I will educate staff and physicians with the use of flyers, pamphlets to patients during their visit with detailed information about this app. I choose mobile apps such as Dexcom. That is a real-time continuous glucose monitoring device that does not require the traditional painful frequent finger stick. It has a small sensor that is placed under the skin, and this is used for both children from 2 years and above, and it monitors the glucose level every 5 minutes. Then the transmitter sends the data to the receiver. Patients can review their trend online and also invite 5 people who could be alerted in the event of hyper and hyperglycemia reaction. A study was conducted, and it shows that those who use a continuous glucose monitoring device and those who have been using the daily multiple injection, the comparison was very, very obvious. It made a significant reduction in A1C on those who have the continuous glucose monitoring device versus those who did not use the continuous glucose monitoring device. It was greater than 1.4% of A1C reduction. The study demonstrated that availability of real-time continuous measurement glucose level can significantly improve glycemic excursion by reducing exposure to hyperglycemia without increasing the risk of hypoglycemia, which may reduce long-term diabetic complications and their associated economic costs. Overall, I believe the study presented support the continuous glucose monitoring app and will show a significant A1C improvement. Patients who use the app, I believe that if such app were integrated in everyday use to monitor the trends of patient glucose, we will see less emergency room visits for hypo and hyperglycemia complications because it provides the required information needed for patients to make early intervention. This is why innovation apps such as Dexcom should be used, and this mobile technology app use is free for patient and family. Financial cost. Dexcom is a medical device that many insurance companies provide coverage for. The app is available in Android, iPhone, and BlackBerry. For individuals without insurance, the cost of Dexcom range from thousands. However, the app is free. My choosing app is mobile innovative and it should improve A1C. The app can be programmed for low and high alerts, continuous glucose monitoring, so patients don't have to stick their fingers as frequently as they would with other devices. The ability to allow family members to monitor a patient's glucose status is more of a reason why innovation is important to the healthcare field. Apps such as Dexcom keep family members alert when glucose is out of range to keep proper intervention and also allow them to review trends of the glucose with the provider. The articles were chosen based on the importance of the choosing topic in diabetes A1C improvement as the key word and will provide opportunity for intersession collaboration. Here are my references.